Hello, my name is Kelly Hernandez, and today I'm going to talk to you about a neurological condition called transverse myelitis. Transverse myelitis is a rare neurological condition that occurs when both sides of the same section of the spinal cord become inflamed. It interrupts the messages that the spinal cord nerves send throughout the body. In this medical imaging photo, the arrows point to the inflammation and lesions that have occurred due to transverse myelitis. Transverse myelitis gets its name from describing the inflammation of the myelin sheath in a band-like section across the body. The myelin sheath is a protective or insulating layer that forms around nerves that allows for electrical impulses to transmit quickly and effectively along the nerve cells. It is made of protein and fatty substance. In this middle graphic, you can see that the area of the spinal cord that becomes inflamed will indicate the parts of the body that will be most likely affected. If it occurs at a cervical level, then the arms, legs, and trunk of the body will be affected. Thoracic, the trunk and the legs, and the lumbar, legs only. The cause of transverse myelitis is unknown, but doctors, researchers, and scientists believe that the cause can be placed in 4 different categories. The most common supposed cause is idiopathic, meaning they have no idea what caused the inflammation. Scientists think that idiopathic transverse myelitis results from an excessive and abnormal immune response against the spinal cord, which leads to inflammation and tissue damage. But the trigger that starts these events is unknown. Some systemic inflammatory immune conditions have shown an association with transverse myelitis. For example, the most commonly recognized would be rheumatoid arthritis and lupus. In some rare cases, central nervous system diseases like multiple sclerosis have shown a connection to transverse myelitis as well. And the last category is infections of many sorts, including Lyme, varicella zoster, the virus responsible for chickenpox and shingles, HIV, Zika virus, and bacterial skin infections are just a few. Symptoms of transverse myelitis can be acute, meaning quickly onset in hours, or can be slow, progressing in days. The 4 main symptoms are pain, which starts in the lower back with shooting sensations down the legs or arms or around the torso. It can be abnormal sensations in the torso and genital region that are burning, tickling, prickling, numbness, coldness, or tingling in the legs. Another symptom is weakness in arms and legs. This is usually an initial symptom and can progress rapidly. As I said earlier, if the myelitis affects the upper spinal cord, then weakness in the arms will be felt as well. Some may experience a partial paralysis of the legs, which can progress to a complete paralysis of the legs. And lastly, bladder and bowel control, so an increased frequency or urge to use the toilet, incontinence, and constipation are some of the main symptoms. Here's just a few facts representing the patient population. Acute transverse myelitis is very rare, with just about 1,400 new cases a year in the US. It can affect individuals of all ages, but most commonly affects the age ranges of 10 to 19 years and 30 to 39 years. In idiopathic transverse myelitis, symptoms can progress anywhere from 10 hours to 28 hours. I chose this bottom photo. It's of a transverse myelitis support group in Australia. And I liked it because it shows the varying degree of recovery from transverse myelitis. Some are able to walk, some are able to move with the aid of walkers or a cane, and then there's these two women in the front who are in wheelchairs, so I'm assuming they're paralyzed. This, perfectly represents this. A third of patients with acute transverse myelitis make a good recovery, a third make a fair recovery, and the remaining third fail to improve or die. And then I chose this photo on the top of this poor little toddler who had to get a tracheostomy to assist with breathing because advanced cases of transverse myelitis can include respiratory muscle weakness, which, is worst case scenario because then you're not able to breathe. Diagnosis includes MRIs and CT scans looking for inflammation or lesions on the spine that would signify transverse myelitis. Blood tests to check for infection related and immune system related transverse myelitis. A lumbar puncture or spinal tap may also be performed by inserting a needle into the lower back and getting a sample of cerebrospinal fluid. The lab then analyzes the fluid, looking for elevated white blood cells or other inflammatory markers that would signify transverse myelitis. The first line of treatment for a suspected case of transverse myelitis would be IV steroids for 3 to 5 days. That would hopefully combat the inflammation occurring on the spine. Plasma exchange can also be used as a way to try to clean the blood where the patient's plasma is exchanged with healthy plasma from a donor. This would hopefully remove the antibodies and other proteins thought to be causing the inflammation. Immunoglobulin made of antibodies can be delivered intravenously to help reduce the inflammation by binding to the antibodies that may be causing the transverse myelitis. Pain medication to deal with muscle pain, and antiviral drugs to hopefully take care of the virus that may be causing the inflammation. As I mentioned earlier, recovery is varied in individuals. Some may fully recover, while others will be paralyzed the rest of their life. Physical and occupational therapy can be used to help try to recover some of the lost movement in legs and arms. I chose this condition because of a personal connection to it and in hopes of making this a little bit more interesting and presenting a case study. I wanted to share the experience I had with transverse myelitis when my almost 2-year-old daughter, right here, was afflicted with the condition. This is Gabby. She was a very healthy and active 20-month-old who, after a very rough night of crying one day and fever, my husband and I decided to take her to the ER. Over the course of the next 12 hours, we noticed she was no longer able to stand, walk, sit up, move her arms, or grip anything in her hands. The doctors weren't quite sure what was going on, and at the time we lived in a small college town on the central coast of California, and it was decided that she needed to be moved to a children's hospital in another city about 2.5 hours away. Because of the risk of the weakness continuing to her lungs, we were placed on a life flight to a city in Central California. After MRIs, blood tests, and a lumbar puncture, it was decided that Gabby had transverse myelitis. She was immediately given steroids to combat the inflammation. Since no indication of anything out of the normal was found, Gabby had the idiopathic version of transverse myelitis. Over the course of 3 to 4 days, she regained some of her muscle movement. She was able to sit up again and move her arms and hands. When we left the hospital about a week later, she was able to do everything but stand and walk. Within about 9 months, she was able to walk again very stiffly and on her toes. And after years of physical therapy and the use of leg braces, as you can see here, she's been able to regain all of her movement with very little stiffness. She's now a healthy and sassy 14-year-old who loves to take selfies, as you can see here. She fared well in comparison to many others that we've met who also experienced transverse myelitis, which we are, of course, incredibly grateful for. Here's some of my references where I got my information, and I think that's it. Thanks.